Hi, we are not going too far in discussing psychiatric section again, delusional disorder subject. Maybe you have heard ever this expression, are you delusional or delusional disorder? What is signify and how to recognize it? And is any treatment for delusional disorders? Definition: delusional disorder is an illness characterized by at least 1 month of delusions, but no other psychotic symptoms. Only delusions, at least 1 month, and no other psychotic symptoms. Delusions are false beliefs based on incorrect inference about external realities that persist, despite the evidence of the contrary. These beliefs are not ordinarily accepted by other members and the person's culture or subculture. Because cognitive organization and reality testing are otherwise intact in delusional disorder, it has been described in the literature as partial psychosis. And non-bizarre delusions are obvious situations that could occur in real life, such as being followed, being loved, having an infection, and being deceived by one's spouse. Delusions that express a loss of control over mind or body are generally considered to be bizarre and include beliefs that one's thoughts have been removed by an outside force, that alien thoughts have been put into one's mind, and that one's body or actions are being acted on or manipulated by an outside force or forces. Making a distinction between delusion and an overvalued idea is important, the latter representing an unreasonable belief that is not firmly held. Additionally, personal beliefs should be evaluated with great respect to complexity of cultural or religious differences. Some cultures have widely accepted beliefs that may be considered delusional in other cultures. And for this reason, you should be careful with patients, especially who are immigrants and coming from different countries with special cultures. By epidemiology, you see that in US, for example, prevalence represents 0.02%, which is even less than schizophrenia, which is 1%. In men, prevalence of the paranoid delusions. In women, delusions of erotomania. The mean onset of age is 40, but can start from 18 to 80. Associated factors with delusional disorders include being married, being employed, recent immigration status, low socioeconomic status, celibacy, and without women. So if you don't marry, if you are married, don't divorce, stay in family, and earn a lot of money to not be in a so low socioeconomic status, and your chances of become delusional are low. It's a joke, of course. Delusions can be characterized as persecutory, that are beliefs that one is going to be harmed by an individual, organization, or group. Referential beliefs that gestures, comments, and environmental cues are directed at oneself. Grandiose beliefs that the individual has exceptional abilities, wealth, or a fame. Erotomatic represent a false beliefs that another individual is in love with her or her. Nihilistic convictions that a major catastrophe will occur soon. And somatic beliefs focused on bodily function and sensation. Okay, and now specific DSM criteria or DSM-5 criteria for delusional disorder are follows: as presence of one or more delusions, so it can be one or even more delusions present at patient with a duration of at least 1 month or longer. Very important, the diagnostic criteria for schizophrenia has never been met. Not hallucinations, if are present, are not prominent, and are clearly semantically related to the delusional SAM. like the sensation of being infected with insects is associated with delusions of infestation, corresponding with action. Apart from the impact of the delusions or its ramifications, patient functioning is not markedly impaired, and the behavior is not obviously bizarre. So other functions are normal out of delusions. All are going around the delusions. If manic or major depressive episodes have occurred, these have been brief relative to the duration of delusional symptoms. And this disturbance is not better explained by another mental disorder like OCD or other. You should also exclude some pathologies, especially central nervous system affection like temporal lobe tumor or epilepsy or steroids use or any substance abuse. Clinical features: the mental status examination, including cognitive examination, in delusional disorder is usually normal, very important, other than the presence of abnormal delusional beliefs. Only delusions are present. Other parts of mental status examination are okay. So memory and cognition intact. Level of consciousness unimpaired. Patients usually have little insight and impaired judgment regarding their delusions. So you should also assess of homicidal or suicidal ideation, which is extremely important in evaluating a patient with delusional disorder. If they are present, you should hospitalize patient. Treatment of delusional disorder is challenging and to treat for various reasons, including patient frequent denial that they have any problem, and especially with a psychological explanation, medical explanation. If you are trying to convincing patient, difficulties in developing a therapeutic alliance and social interpersonal conflicts. So establish a therapeutic alliance and negotiate mutually acceptable symptoms, symptomatic treatment goals. Start where the patient is at. So you should be at the part of the patient and understand, even accept some of the beliefs initially, and offer empathy, concern, and interest in patient experience of the beliefs. With an appropriate permission from the patient, once again you should ask patient to befriend as a friend with him or her. Otherwise, he or she will not allow you to make any examination, at least. So include the patient's family members in decision making and educate them about symptoms of the patient. Consider the impact of culture on illness experience. Important: avoid direct confrontation of the delusional symptoms to enhance the possibility of treatment compliance and response. Use medication judiciously to target core symptoms associated with and associated problems like depressed mood or irritability. Hospitalization is needed if a patient delusions cause her or him to be a threat to self or others. And recognize and treat comorbid psychiatric section. Exclude any of the possible pathologies that can have these delusional symptoms or delusions simply. And of course, drug administration and supportive psychotherapy. So systematic review of the literature shows that olanzapine and risperidone are the most common atypical or a second generation antipsychotic used. However, some evidence shows that a superior response to the typical third generation agent like clozapine. Clozapine is universal and used in a resistant patient with psychosis. And antidepressants that also have been successfully used for the treatment of delusional disorder, also primary of the somatic type, and showed improvement, of course, SSRIs or clomipramine, imipramine, and supportive psychotherapy if symptoms are not so pronounced and it's for a long period of time applied. Patient should come often to you and discuss these beliefs. Have a great time and thank you for your watching, guys.